Okay, let's get some analysis then on this. So we're joined by Professor Benjamin Smart, an Associate Professor in the Department of Philosophy and Director of Future of Health and Medicine Project at the Institute for the Future of Knowledge. Well, a very good afternoon to you, Prof. Thanks very much for joining us here on SABC News.
Good afternoon to your viewers.
Prof. Smart, let's first start off by getting some reaction from you to that announcement today then by government to extend the National Disaster Act by a month. I'm sure you've heard some other commentators, especially in the clip that we just played before talking to some saying there's no scientific basis for government to extend it. Some saying that there is no disaster in South Africa, that this is an unnecessary and irrational decision. What are your thoughts?
Right. Well, I can identify and understand the frustrations with the opposition party leaders there. Although it might be a bit strong to say that there's no disaster, it's certainly the case that the number of deaths being caused by the Omicron variant has decreased substantially. It's the case that we are now approaching endemic status. This is not the disaster that it was in mid-2020, and it would be nice to have some clarity as to why the Co-operative Minister, the National Coronavirus Command Council, have decided to extend the state of disaster, given these facts.
Yeah, and I mean, are you of the belief that we're likely to see, the extension beyond the 15th of April, considering the fact that, we've heard that the fifth wave is right at our doorstep, and countries like China have imposed new curbs amid the COVID-19 outbreak, and have said that this is quite a bad wave that they're experiencing? You think that the South African government will take a leaf out of China and further extend, and especially given the amount of criticism they've received now about extending for a month, one wonders if they were to extend again next month, what would then happen? Are you of the belief that it is likely that would happen?
Well, I think we have to draw a distinction between the waves of infection and the harm that the infection is doing. So I'm sure that we are on the brink of a fifth wave, and after that a sixth, and after that a seventh. The chances are that this virus will continue to mutate. We'll get new variants. Some of them will be more contagious, and we're going to get wave after wave, most likely. It's going to become an endemic disease, much like the seasonal flu. The really important question is how much harm is it doing? And even in the peak of the Omicron variant, healthcare facilities were perfectly able to cope with the number of people that were going into hospital. Because we have a certain degree of immunity here. We have a lot of people vaccinated, but in addition, a huge proportion of the country now have had coronavirus, one variant or another, and that's providing some protection. And so there just aren't the number of deaths. One can only assume that government are trying to get their ducks in a row when it comes to providing the 350 Rand grant through ordinary legislation and so on. But, it's not really acceptable to have this going on indefinitely. The state of disaster gives the Co-operative Minister a de facto Prime Minister position in the country. It means that vast quantities of legislation can, in principle, get through without parliamentary oversight. And this, everyone is aware, needs to end. So I'm sure the government is doing its best to sort out those loose ends. But one wonders exactly what it is that they are trying to sort out, and when they'll be able to finalize that.
Well, isn't that quite concerning? You say that the government needs time to sort out loose ends. I mean, it's been 2 years. Have they not had that 2 years to think about the time at which the National Disaster Act would have to end, and that we can carry on as per normal? Surely we can't say that this extra month will make much of a difference. I mean, given the fact that you've already had 2 years to think about it.
Well, I agree with you. It doesn't make much sense, and one wonders what it is that they're trying to achieve that can't be done with the parliamentary oversight. So the 350 Rand grant can be done quite easily using existing legislation. what would be a struggle would be to maintain restrictions on social movements, any kind of curfew, anything of that kind of nature, because outside of the state of disaster, these things are unconstitutional. So perhaps there are certain regulations the government just isn't ready to discard with yet. But I do wonder what they are. Public health experts are just now advising that really almost all of the measures that have been put in place over the last 2 years are now obsolete. Mm-hmm. Countries in Europe have football stadiums open. Mask wearing is only mandatory in indoor spaces. In some places, not mandatory at all elsewhere. As I say, the things that really do need to carry on, like the 350 Rand grant, that can be accommodated for within the current legislation outside of a state of disaster with parliamentary oversight. But one wonders exactly what it is that governments are trying to achieve that can't be done constitutionally outside of the state of disaster.
All right. Thanks very much, Prof, for giving us your time here on SABC News. Certainly do appreciate your time, Professor Benjamin Smart.